at 6 o'clock. If we could have roll call, please.
Chris Brune.
Here.
Adam Carson. Linda Hoke.
Here.
Lindsay Keisman.
Here.
Ray Lapinus. Amy Rath.
Here.
John Reinert.
Here.
Carolyn Schofield.
Here.
Connie Machini.
Here. I guess instead of getting up and getting the sheet, is there anyone out there that wants to make public comment tonight at all? I don't, okay.
I can bring you up a list.
Yeah, would you do that? Thank you. I could run over there and get it too. Thanks so much. Okay. Well, since you're up, Bobby, you might as well have 3 minutes to get our attention. Go ahead.
Thanks. Yeah, and I'll keep it short. I just wanted to thank the board again for the support of the apartment building project that we're doing on Borden Street in Woodstock. We had to work out details and everything, so everything just got signed a couple months ago to make it official. That funding got us over the top to proceed with adding 12 beds of three-quarter living for Woodstock. I wanted to announce that to keep you guys in the loop, that we were finally approved by the city for all of our permits. So currently working with them to try to hopefully get the amount of the permit down a little bit, since we're a nonprofit. But as soon as that's worked out, we're ready to break ground next month. So I'll share with the full board when we have the groundbreaking ceremony.
Good.
I just wanted to thank you again for the support on that.
Thank you, Bobby.
Yeah.
Stephanie Gatone.
Let me know where that.
Bring it on down to yourself. Okay.
I'm Stephanie Gatone, for those of you who I haven't formally met. I am the program manager for Live for Lolly in McHenry County. I just wanted to formally invite everybody to our grand opening. It's July 1st at 9:30 to 1. It's kind of an open house type of ceremony. There's a quick ceremony in the beginning, but then it's just an open house. So whenever works. If you want to stop by and see the cool things that we're doing and meet the whole staff will be there. And then I also wanted to share a little update on one of our new positions that we've gotten funded this year, our educator position. So the idea of the educator position was to try to get into schools, and that has been a hard thing for us to do until this year. We did it, and we started slow with a couple schools, and we're hoping to have more in the fall after the word gets out on how great it is and how receptive the kids are. But last month, we went into a high school and we trained 1,270 students at Jacobs High School, and then we also went into Woodstock High Schools too. So super exciting. Hopefully there will be more to come. And that's all I got.
You want to tell us the address of Live for Lolly? So we know?
Yes, it's 665 West Jackson Street. And it's all the way in the back, unit 2C, which I have some flyers, but I forgot them in the car, so I'll grab them.
Is that Jackson way out?
Yeah, it's over by CCCS.
Okay.
So on the other side of the cemetery.
Okay. Okay, thank you.
Yes, thank you.
Is there anybody else that wants to do public comment? If not, then I need an approval for the minutes on May 27th.
A motion to approve the minutes for May 27, 2025.
Second?
I second.
All those in favor? Aye. Okay. There are no presentations, so I'll give my report. Just remember that we had voted on the regular board meeting in July is the fifth Tuesday, it's July 29th. And board self-assessments were distributed and due this July 11th. So if you haven't filled it out, please do. To bring you up to date on the executive director search update, we've had 50 Indeed applications. They have to go through the county, so they were told to go through the county. We have now 7 that have gone through the county and filled out the application there. The 7 people have filled it out, so we have those waiting. A lot of people have looked. I think most of you have gone through the applications. If not, please do. The applications close the end of this month. and then we should be ready to interview applicants. There are questions that I got from a lot of you for the executive director search. You will get that in our executive session, the questions. It was hard to put them together, but we did. Bridget and I sat down and cross-referenced and did all that kind of stuff and got them into one document. Nomination for the election of mental health officers. We will have the nomination down in new business, but your slate of officers for next year is myself as president, Ray as vice president, Lindsay as treasurer, Amy Rath as secretary, and Carolyn Schofield as assistant treasurer. That is our slate of officers. Training and education opportunities are in your book. I'm not going to go over each one, but I have to tell you, I went to training last week here, and it was phenomenal. I mean, the training here is really good. So I would encourage you to look at what we offer. So I don't have anything else on my report. So we'll move on to the operational report. Bridget and Mel, do you want to make any comments on it? I mean, we have it, but
Any questions? Did anyone have any questions for either of us?
any questions on the operational report? Okay. All right. With no questions, we'll move on. Finance and Audit Committee, Lindsay Kiesman, please. I keep forgetting that. There you go, Lindsay. It should have come on.
So Finance and Audit met with a focus on looking at our funding priorities as we went into the mid-year funding allocation cycle. So we had a conversation about the difference between funding our fee-for-service providers versus capital requests, what kinds of priorities we would make, and in conjunction with that mid-year application pool, Finance Committee came together to review a couple of scenarios that staff presented on different ways that we would kind of decide who to give money to, how we would do it, how we would make prioritization. And in that conversation, the Finance Committee came up with the recommendation that you will see today with, I think, some minor adjustments because additional funds were found. And along with that, we had a conversation about the Child Advocacy Center request, and Finance Committee did not make the recommendation to do that at this time, and encouraged staff to get our grant writer in connection with them to see if there were opportunities for their building needs through that. Any questions? Okay.
Okay. Then on the consent agenda, I need a motion to approve the consent agenda 6A, 6B, and 6C.
I'll make a motion to approve consent agenda item 6A, finance report, 6B, opioid fund reports, and 6C, monthly bills.
Second?
I'll second.
Any discussion? Then we need a vote, and you vote on your little screens. Okay, passed. All the consent agenda. Old business, grant writer options, which you have in your packet. And even on the operational report, you can see they have done a tremendous job in doing applications, the grant writer has. And so you have in front of you options that we requested from the grant writer. Trying to find it here. If we give him more money, what he can do. He said, we talked to him that there's plenty of grants out there, local, federal, but it's up to us whether we decide we want to increase that this year or not?
For FY '26.
Yes, I'm sorry, FY '26, for starting in December, because we already have our contract. Discussion? I'm trying to get out of here, close that.
Oh, thanks. I have a couple things. First, I don't know who put this together, but, so I don't know who to direct the questions to. Okay, thanks. So I was curious because it says as is, they're doing 4 to 8 grants for the 50,000, and then it says for 75,000, they'd get 6 to 7 grants, which fits in 4 to 8 grants. So I'm kind of trying to figure out, what does that 25,000 more give us? Because in April, looking at that sheet, there were 6 that they did in April. So it looks like they're in that 4 to 8. So what more would we really get with that extra 25,000?
That's a good question, and
Okay.
that's what was presented to us. So I guess now he can do 4 in some months when he does 8 in others, and I guess he would do a minimum of 6 every month.
Okay, so I think last time we talked about this too, we were kind of thinking, well, I mean, I kind of at least expressed, let's kind of stay where we're at. If it ends up that he comes back and is like, you know, I'm maxing out my time, but there's so much more still on the table that you could have, then I think we could reevaluate. And I think we've even talked about we'd probably be able to find that extra $25,000 somewhere else, you know, if we needed to on a mid-year or at the time. So I guess since I don't see a significant potential for more, and it seems like right now is satisfying what we need. But again, I am not opposed, because I'm a huge advocate of the grant writer. I'm not opposed of revisiting this if, you know, we're all exhausted on opportunity and, you know, he thinks there's more to, or he's maxing out what he can do and still thinks there's more on the table. I'm willing to invest in it. But I just, from this especially, I just don't see what it's going to get us.
I agree. I think that he's doing a good job with us now, and you're right. If we need to see it down the road, that's my opinion, we can always add to it. But he has a staff, I didn't realize, of 18 people sitting in Washington, D.C. So anybody that, our agencies that find a need for grants could bring it to us, and we take it to him, so. Okay, is there anybody else? Okay, I'm trying to find you on here. Okay, Linda.
My question was basically the same as yours, Carolyn, but I wanted to know how many grants are they currently doing per month? Applications.
I think 4 to 6.
Right. But I just wondered if it was always at the 4 level or if it was towards the higher end. Because if it's towards the higher end, I was wondering if option 1 is just an increase of his current prices for the same, you know, like our
Right. Well, so
costs
far
going up.
in '25, he's submitted 17 grants in the first 6 months of the year, so not,
So is he talking about a price increase for the same service for next year?
I kind of felt that way. It really did. I mean, he really didn't.
So, I mean, I would
show
say
much
stay in
more.
the same place, except if he's raising his prices, that's a big raise. It's a, 25% increase.
No, he's not.
You don't think it is? Okay,
No.
well then yes, I would say stay in the same place as well.
Okay. Chris.
Yeah, Carolyn, I appreciate you pointing out the inconsistency. Still, 17 in 6 months, so average of 3, 4 a month. If we can guarantee at least 6 a month, then the likelihood is that we'll get at least 2 additional grants in the coming year, and the amount of money that will bring in will probably exceed the $25,000. So I'm going to be in favor of maximizing the use of grant writer, and am willing to increase the amount that we pay for them. I'd like to go back to them and ask for clarification about why they're now saying, they're giving us 4 to 8, and now they're offering us 6 to 7 for more money, so that we can have a clear statement about what additional work we'd be getting for our additional funding. But in general, I think that the return on investment is significant and that we should put what we're able to into this initiative.
Any other discussion? John, I'm turning you on there. Go ahead.
And again, just another naive question, like I normally do here at these meetings.
Okay.
But I'm just curious, when we communicate with John Thomas or when anyone, do we send out a need for specific areas and grants? How do we communicate with them? Do we just send him the contract money and see what he comes up with for us, or do we?
No, that,
How does that work? Because, I'm seeing like we're always low on transportation, or,
Well-
we need a bathroom. Do we communicate our needs, or does he just start shooting wildly and see what he can
No.
get for us?
I can
don't know
answer
how it
that. We
works.
do communicate our needs.
Is that how
we
is that
do.
the mode of operatum?
Yes, and if an agency tells us that they have this idea for a grant or whatever, we will let him know that. So we do let him know our needs, but of course, you have to see what grants are out there at that time, and he researches it. So say there's none in transportation, he can't write any in transportation, but he knows our needs. And when we talked to him on the phone, he said he can do whatever we want him to do. But the contract was for 1 year, and what is it, 4 to 6 a month that he's supposed to provide?
4 to 8.
4 to 8 a month right now.
I'm certainly a fan of a grant writer because I can see the outcome. I mean, he hits. I mean,
Well, he's done really
I'm
well.
perfectly a fan of it, but when we're sending him direction and he's getting us those grants written, I don't see the need to have him start shooting more. I mean, unless he were to tell us, I need more money to write more grants, and he hasn't created a need for me. Am I missing something in this correspondence?
No.
Does he say he needs more, or is he
No,
just
no,
saying?
we just asked him if he could do more. When Bridget and I talked, and Bridget, you can jump in here too. When we talked to him, we asked him if you had to do more, if we wanted you to do more, what would the cost be? Right now, he has a contract this year, 4 to 6, 4 to 8?
4 to 8.
Okay, that he's doing a month. And he is doing that. I mean, take a look at the operational report. You can see the grants that he's applied for.
Absolutely.
And
And also just to state, the ones he applied for aren't necessarily the only ones he worked on. Some he works with an agency and then they find out that they don't have the right information or the grant's not the right fit. So I mean, there's some things that just don't go to the finish line that he has been working on. So you might not see the true work.
So Melanie, I guess this would be kind of directed towards you. Do you feel a need that he needs to write more, or do you feel that we're getting adequate service where we're at?
Want me to answer that? So because we just started with a grant writer, basically within a year, the initial part was him getting to know the organization and all the agencies. And a lot of the initial meetings between the previous ED and the grant writer was really getting to know the network. And so that was, I think he spent a lot of time doing that. Now, I think they're really getting into the meat of finding the grants. So he knows what he's looking for.
And he knows what agencies might.
He knows what agencies might need it, and then he's reaching out to multiple agencies for each of them. So I think that it might start to sort of snowball a little bit more, and I think the direction is a little bit different now than it was previously, with a little more board direction about giving grants, opportunities to all the agencies that need them. There might be a lot more opportunities for grants. So it could be. It's just this is very inconsistent. The way that this is written does not make sense at all. So I would be willing to take that suggestion to go back and ask him to clarify that and come back to you with some more information. because it's not
Right,
consistent.
and
But
a
he,
decision doesn't need to be made tonight.
Correct.
No.
It doesn't, the new contract won't start until December, so
Right.
it's just kind of giving you guys
So
the
do we need
information we
to
got.
vote
from-
on this?
No.
Or put a time specific to revisit it? I mean, if we vote no, I mean, are we going to?
We can go back to him and get more information and then vote at
Yeah.
it later. It's just to look at it now because the board did
Well, I
table
would
it.
certainly hold back and then
Yeah.
wait for more information.
We can do
Yeah.
that.
Thanks a lot. That cleared up a lot of my questions.
Okay. I'm sorry.
I love the idea of getting more clarification, and for me, I'm actually in agreement with Chris. I am interested in increasing it if it's looking at the minimums of 4 and putting it up to 6. And I know he's never going to be able to give us a firm number, right? But a minimum is a number, and the reason for that is because one month there might be more opportunities or there might be less opportunities. However, if he's going to dedicate staff time to looking, thinking, doing, partnering with our agencies, the $25,000 to see if we yield, a 30+% increase in outcomes, I think is worth the exploration, even if it's just for FY26. We have a first year of grant writer data, we have a second year of grant writer data, and I think that would be much better information to inform any other budget up or down for FY27. So for me, I would like to know what the minimum is when you talk with him, because that is what I'm looking at, is increasing our minimum from 4 to 6. So I'm in favor of the $75,000 option, if it is what I think it is.
Any other discussion on that? Okay, we don't need to vote on it now. We'll go back and get some more information. Okay. Pardon me? I will get you right on. Okay, Linda.
The other thing I would be interested in is, are there enough grants out there for him to go up to a higher minimum?
Well, he says he can go for as many grants as we want.
But are they out there?
He says there are. When we talked to him on the phone, he said there are always grants to go after. I said, in the new regime of government, is there? And he said, yes. So,
and to clarify a little bit, what he said was, with the climate changing, he really sees a lot more local and private grants coming up, and there's a lot more availability for that as well. So,
okay. New business. We have Mr. Austin here from the county, and he'd like to have the floor with the board for a few minutes. I'll get,
Good evening. Am I on? Can you hear me?
Gotta turn them on. No, you're good. Now you're good.
okay, there you go.
Can you hear me now?
We can hear you.
I'm Pete Austin. I'm the county administrator. The county board and the mental health board, long history of working together, and I'm here because we want to continue to work with you guys. County and I have had multiple conversations in the last month and a half, 2 months, and more recently having some conversations about the executive director and getting that position posted, and even more recently than that, the compliance officer position and getting that posted. And it sort of prompted a series of questions that I had. And I essentially invited myself to here, so I appreciate you putting me up at the table. Because I want to help. I want the county to help, and I want us to help in however you want. But, the county board leadership, I think, recognizes what is sort of natural whenever there's transition in personnel. It's important to kind of look at what skill sets do you need next? What jobs do you need next? And is this time to kind of do some of that reevaluation? And I'm here to tell you, I think some of the county board members would like to see some of that reevaluation of what's being done down here at the staffing level. And I know that this staffing group has gotten very lean over the years, and I think that's appreciated, but is there an opportunity to even get leaner? I think that's what a search for the next director of this organization can be about, asking those candidates, how do they imagine this organization looking, and doing some kind of self-searching about what needs to get done. Not what, and so this, what kind of prompted this is there was this discussion of do we have an executive director job posted at the same time we have a compliance officer position posted. Personally, I think that sort of sets in motion more of the same, because you've got two job descriptions and with skill sets that are resembling what you had before. And if you take this opportunity to hire your next director with he or she has an eyes on doing things differently, or at least examining what has been done here in the past and perhaps doing something differently or not, I don't know. But let he or she craft the job description for the next compliance officer. What skills? We don't know yet. What skills, what degrees will your next executive director have? But, if you fill the compliance officer role, it seems like he or she, their skill set should partner with your executive director, and not, we shouldn't be hiring the two at the same time and not knowing what the two skill sets are. I draw another parallel. If I was to leave the county tomorrow, and a couple weeks later, a key department head left, director of HR, IT director, you name it, right? The county board would still focus entirely on replacing or finding the next county administrator. And the county board would say that our job is to find the next county administrator. And then the county administrator is going to figure out what they want for that next department head. What they would do some assessment of what skill sets they want to see in that next department head. It would not be the county board making that kind of decision. I know that's just my perspective, and I'm here because I want to help. But I think that to put a compliance officer position out there that says I want a master's degree, when you don't know what skill set the executive director is going to have, I think it's premature, frankly. You don't have a big organization, so do you even need the 3 levels of management that are underneath the executive director? These are valid questions. You may decide at the end of the day that your next group, when fully staffed, looks very much like it did, but it may not. And I think if I was this one of those 7 director candidates or somebody else out there, I would want to make the decision about the compliance officer decision, or at least I want to be a party to it. I wouldn't want it. Oh, you're starting in 3 weeks, and this person is going to be your compliance officer. I don't think that's the way this should unfold. But we're here to help at the county, and we'll do whatever you want. And I've told you that. I mean, I've said point blank to my HR staff, I said, I'm not going to stand in the way of what you guys want to do. I'm just going to offer my opinion. So that's kind of where I'm at.
Yeah, talking to Pete, and I just want you to know, the county has really offered to help us any way they can. And I held off posting the position until Pete came here, because he made sense to me. Maybe the executive director, whoever that may be, he or she, would pick their person and look at the organizational chart too, if it needed to be changed or not, or how they wanted to add it and who we're going to hire, what is their skill set. So that position has not been posted yet.
Right.
The executive director position has. So does anyone have any questions of Pete? Carolyn, I know you're, just a second here. There you go.
Thank you. And I really appreciate you coming in, Pete. I know we've talked about this for as long as I can remember since I've been on this board, just the county and the mental health board working together, and, our relationship, I think, has greatly improved over the last couple of years, and especially, I've seen a huge improvement, and I think we're all very much aligned and supportive of one another. So I do appreciate the analogy that you gave, because I think that paints a very clear picture of where the board falls in with the hiring hierarchy. And I know we've had some conversations, and I brought a little bit of it back to the board, as well as opportunities that we may have kind of going into this new way of possibly thinking with a new ED. Obviously, there's going to be a lot of changes. I think the more I learn too in talking with people of kind of what the last ED did versus the one prior to that, and they've been very different along the way, and I anticipate that this is an opportunity to change it as well. So where do you think, are there other opportunities within the county? Partnering together and working together, that's always been my driving force of shared services and efficiencies. So I know we've had some discussions, and maybe you can even highlight if there's some off the top of your head, but the ones that I can think of are like, audit, if there's audit possibilities. I know we've used the auditor's office in the past, and maybe opportunities there, or public health. We've kind of talked about partnering with them on some things, or even like our building and facilities. Is there an opportunity there? And I know I'm throwing this at you right now, and we haven't talked about this, but do you see potential for opportunities that if a new ED does get in and is really wanting to find that partnership?
I appreciate that. And, that sort of is, I guess, at the core of what I think could be some central questions to your next director is, are they going to seize every opportunity they can to look for collaboration opportunities? And there are a lot, and there already exist. Your mental health board is paid through county payroll. It doesn't have to be that way, but it is, and it works, and it makes sense. And we've supported a lot with IT. We have supported a lot with facilities, HR. Those are good examples. I think my conversation with the health department suggests that there could be greater harmony between mental health as a key public health component and the balance of what the Board of Health does. I don't know how much that's been explored in the past, so I can't suggest why it hasn't been real robust, but I think there is definitely an opportunity there. You reference audits, and I'm learning just in the last 2 months about what your compliance officer was doing, and it wasn't an audit in the traditional sense necessarily of finances, although I think there was elements of that. I think the county finance department and the county's elected auditor can help and are willing to help in that, and particularly in this time when we're down a staff person here. But this other level of sort of clinical audit, 132, whatever, I don't know what I'm talking about, right? So let's just accept that. But is that what I know what it has been, but does it need to be in the future? And I think your next director could help you ask some of those questions of the time and expense to have that level of 132 audit versus the benefit. Your time and expense, and those that you're allocating dollars to, their time and expense. I don't know those answers, but I think it's when you have these kinds of times of transition, I think it is worthwhile to look at that a little bit. And that's why I said if we take a half step on filling the compliance officer position, we can have some more thoughtful discussion on what does that look like. Are there other opportunities to? Yeah, absolutely. And we're always looking for
Transportation I'll throw out.
What's that?
Transportation I'll throw out also.
We just throw out transportation, right? I mean, historically, the executive director of the mental health board has been a very regular participant in the monthly department head meetings. So we're always having dialogue. We're always looking for those next opportunities. Our county coordinator is always looking for next opportunities to kind of partner. You guys have been wonderful partners with the police social worker program and with our specialty courts. And I would love for some of the county services to continue to kind of buttress what's happening down here. We have to keep our eyes always looking for those next opportunities.
And I really appreciate that, and I'll just say two more quick things. One, as I was looking at other mental health boards, 708 boards in particular in the state, and yeah, they don't seem to have that robust auditing process that we do have here. So I know we've asked those questions, you know, I mean, Karen was phenomenal and extremely knowledgeable, but I also always felt like, you know, is it really needed in our capacity? I mean,
To that end, I sort of interrupt, but I too, I had a pretty in-depth conversation with the Winnebago, with the group that's doing the Winnebago County Mental Health Board, and they're a new model, right? So they didn't have any preconceived notions of what should be, but they aren't doing that kind of in-depth review. What's the savings there? Well, we can kind of judge that because they're spending 3.5% to 4% on administrative overhead. But what's the cost? And that I don't know. You know, so what is the extra 132 review get this group, you know, to help make decisions that they don't have in Winnebago County? And that I don't know the answer to that.
yeah, and I don't know that we do right now either. And then the last thing, though, is like fundamentally, and I ask all these questions is because I kind of break it down to like, what is the mental health board? I mean, we're really an allocating body. We don't provide services. We provide the community with those that do provide the services. We fund those. So we're a funding agency. And I look at that like it's more a governmental body. It's not, we're not a provider. We're not, you know, we're not the one that's actually doing the services. We're taking in funds and we're finding those to fill the needs of our community. And I just think it looks at it differently than like a clinical setting. We're not the clinicians, we're not the social workers, we're not the licensed individuals. We're the ones that know who are and then how to distribute that money. So I look at it like, again, and I'll say it, you know, any opportunity to collaborate with the county, any opportunity where we can find kind of those overlap or efficiencies or partnerships with other entities within governmental within governmental bodies, that's just more money that we can allocate to the community and to the providers that are providing those services. So I am in huge support of, you know, doing an ED search, I will continue to advocate for those philosophies with that new individual, because I feel like that is such at the core of the existence of really of any ED. I mean, fundamentally they should be about, you know, finding the way to make their organization be the best producers and be the most efficient in their administrative end and maximize their capacity and the work that they do. So I am for going with the ED and holding off on the compliance and, you know, having those conversations as to what the future of that might look like. So thanks for coming.
You know, I have to just throw something out. When I talked to Pete, I said, you know, a lot of board members and people are saying the ED should be a social worker or ED. And he said something that made sense to me. He said, do you think that I know how to run transportation? Do you think, no, you did say that.
Well, yeah.
Do you think I know how to do all these? But I am a manager. I manage the county. And that's what we should be looking for, is somebody who manages the mental health board. You know what I'm saying?
Yeah.
I'm sorry if I said it wrong.
Well, you said it right. Essentially, you know, there are positions reporting to my position that are specialized. You know, I'm supervising IT, I'm supervising engineering, I'm supervising GIS. Some of those things I'm not an expert in, and that's really your message. But you know where to get the information, know how to put the right people in the right places.
The right people. Okay. So just.
But there are county administrators who may have more specialization in HR, or some may have been a past engineer or something like that. So those individuals might have a different perspective in hiring the people that are subordinate to them, you know, wanting to balance skill sets. So that's to me is a reason, not the only reason, but a reason to hold off on hiring the second position until you can have your director be part of that.
So just so you know, that's why I put it off.
Very sage conversation.
Chris?
Nice to meet
Me too. Mr. Austin, thanks for coming to our meeting, and it's valuable to us to hear about the county's perspectives. I wouldn't know that otherwise, and it's, good of you to take your Tuesday evening and come down here. So the thoughts that are running through my head as I'm listening to the conversation have a lot to do with what this would look like. I think we do have a sense of what the skill set of our new ED would be because it's in the job description. We know what the degrees would be, what the skill set would be. And if we were to hire a compliance auditor in the way that job description is written, we know what that would be too. What I wonder is, if we hire someone who's has not done this specific job before, they're going to have a learning curve, right? And the new executive director is going to have a learning curve. It's going to take a while to learn job. It's a complicated job. In the meantime, we're already accumulating a work backlog because we don't have that compliance officer now. And fundamentally what they do is make sure that we're getting what we paid for, which I have a sense like, yeah, I want to know that we're getting what we paid for. I want to know people are using the money that we allocated as was intended, and that folks in the community are getting the services that are intended to be delivered based on that funding. So I worry about the accumulating backlog if we postpone this for a long period of time, which it could be. I don't know how long it's going to take to get an ED. I don't know how long it's going to take for them to really onboard. So that's in my mind. And the other thing is that, one of the other things the compliance officer does is they get and kind of like organize information on program evaluation that's done by all these agencies. So they give us information on their outcomes, like are they delivering, successfully on the outcomes that they're supposed to deliver on. And this is helpful to us in making funding decisions because we're like, okay, if, they said they were going to do this, they did this, they had this level of outcome, that's, that's an agency we want to support, that's going to be influential to us when we think about how should we make funding decisions, which is going to be in the fall. And as time goes on and we don't get these data, I don't know, how we're going to be able to make fully informed funding decisions. So I have a little bit of reservation in terms of thinking about the delay. So I just want to put that out there.
And I appreciate that, and that's kind of how I understood things, frankly, is that this way of doing things was a path that we could head right back down. What I also understand is there are other groups doing similar things who maybe aren't requiring as much data and as much information on compliance that maybe I don't know. That's the cost-benefit analysis. That's Winnebago County. I don't think is getting that, or they're getting it in a different way. So I'm just saying that that's a perception, and if we aren't allowing that to at least get some oxygen to look at a different way of doing things. To my knowledge, no one has yet approached the county finance department or auditor's office about trying to get any of this other information. I don't know how much is not being collected now. I don't know how you reference a backlog. I can't quantify that. So I'm not suggesting you're not correct, but these are things I think should be looked at. What do you need to make the best decisions? Not what have you received in the past, but what do you need? What's the cost of getting that you need, and what's the benefit?
Just so you know, we are doing audits now with the two people we have. It's in your operational report that they are being done. And I didn't realize you can hire out people who will do compliance for you. I didn't realize that. But when I talked to other agencies in the state.
Does the next compliance officer need to be at the manager level? Or do you need another worker person? I don't know. I think your executive director could have a role in helping you decide that.
Just a second. There you go.
I appreciate the conversation, and I have a tornado of tangential concepts swimming around that I want to put out there. for those of you that have been around for a minute, you heard my opinions on the deputy director position that was presented, and I said, what happens when somebody goes out, and then what happens when that person goes out? And we're living that experience right now. So, I think it's going to take an executive director a full year to make a good decision, probably, on this. We have staff that, may inform us as a board on what they see, different versions historically that have worked, not worked, where the needs, the gaps are. We talk on one hand about, hey, let's, drop down the executive director requirements, let's do a bachelor's level, let's get somebody that knows how to do board and governance and all of that. Then I think we absolutely have to have, a licensed professional as a staff person. Now, should that person be a manager? I think we could talk about that, but then that brings more managerial burden on the managers that we do have. So much of our strategic conversation was about freeing up day-to-day operations so that we could get more of the information out there in the community. And our executive director struggled with doing that with the capacity that we had. So much of, since I've been on the board, has been, we would like better data, clearer data to help inform our decision-making, better outcomes, especially when we sit down and we see things that don't add up. For allocations, we'll look at something and say, here's 3 like programs. Why are 3 like programs telling us, for the same amount of money, they can see 10%, 20%, or 30% more than the other program? And we don't have answers to that. We need a very informed person that understands the inner working of human services to even, I think, get in there. And I think that's what we had with Karen. So beyond compliance and auditing, I think Karen had a systemic understanding of how all sorts of service providers work. I think she was auditing finances. She was auditing, nobody wants to audit Medicaid, but she did, she knew things. And beyond knowing that, I think because of that inner working, there's been a conversation with funded providers, potential funded providers, about the opportunities that exist, how to bill. Did you know this was a billable service? Could we get you, hooked up into these other things? I see all those opportunities potentially going away if we don't make sure that we've got somebody like that in a leadership position. With that said, I could fathom a world where if I was the next ED, that I would name this person the deputy director, because I think there should be a natural second in command. We had to put a point person into place with Bridget because of, just the need of that. I think there's a natural need for somebody to be the manager of other people when your ED is gone, out, sick, or not here anymore. And so for me, based on what I would know, I'm concerned about waiting. I would love for that executive director to make that decision. However, I also think that based on the job description that exists to replace the compliance position, that person is a natural candidate to move into a second in command. That's how I see it. So I think some of those opportunities would still exist as far as maybe reorganization or changing, things in the future when an ED has a good understanding of kind of the inner workings of what we do. So I'm hesitant. I both like the idea of waiting and think it's impractical because I think the learning curve is too long. In the meantime, we can't not have a clinical person that understands those things in place. And we can't not have a manager in place either, because we are starting to lose our sustainability here as one person goes and the next person goes. So I'm sorry that was long-winded.
I'm going to ask you a question because
Yeah.
I'm not quite understanding what you're saying. Are you saying that the second in command shouldn't be it should be a compliance but deputy director position? So we do have a second in command, whoever the executive director, I'm just trying to understand what you're saying.
Yeah, whatever. Magic wand me, the ED, and I know everything I know. If I was going to look at a restructure, that might be the only restructure I would make, right?
Okay.
Which is still a body in a seat doing a thing that would probably be 90% of what Karen did every day, but, is also the point person when your ED is out, right? Because I think naturally you do want somebody in a higher up position that understands the human services industry, has worked in it, walked through it, led it, who understands, some of the ethics and compliance things that go with that, quite honestly, you don't always get trained in doing that unless you, have a licensed social worker, a licensed counselor, somebody that has been in the position, or any of the other licensed, positions that almost all of our funded agencies have to have. I think it's valuable to have that person on staff. I think that's the natural person that if your leader, whose day-to-day operations could totally be management, leading, being out in the community. So to me, that position was always a natural role. And I think the job description is a natural fit for still being the point person.
But you're not saying it should be it could be a deputy director.
I feel like I've made my point clear that I always thought we needed a second in command. When we first talked about it, it was in addition to, these three managers, and I don't know that I totally saw that as a good fit. So I like the idea of rethinking it. I don't know if it's our responsibility as a board to do that. I do think an executive director's job is to determine how to run their organization. I do believe that. I also am a realist, and unless we're going to get somebody into a position who's been running a large mental health board for many years to relocate to McHenry County, I think they're going to have a year-long learning curve. And that is way too long to wait to fill this position. So I'd rather fill what we already have in existence with an understanding that, potentially we're looking for a flexible candidate. That role is really flexible, as far as what they could be doing in day-to-day operations, because they do have a team of people that can audit. But correct me if I'm wrong, but when Karen left, she said, my auditing team is great, but there's a couple of larger agencies, larger programs that she had more specialized knowledge of that not necessarily her staff did. And in those cases, we need to have that kind of caliber person in place to do that, and to know that they need to do that, and to know the difference between who are the staff that can do this, who are the staff that shouldn't do this. And that means that they are a manager, or maybe your executive director knows that, but then they probably have to be a clinically licensed person, and we're talking about backing that down. Hence the tornado conversation. I feel like if we do one thing, then that impacts the other thing. So yeah, Pete, I wish it was different. I'm concerned that, because I totally agree with you. I'm also just concerned that we need to fill this gap before a person could have an educated opinion on a restructure. So I'll stop talking.
Amy?
Yep, I'll be quick. I hate to be the, why don't we do nothing? But if the EDs, if those applications close in a week and we begin interviewing, does it make sense to see, I know we've looked at the resumes, I have looked at them. That's not the same as talking to the person and hearing what their plans are. I do wholly buy in to the executive director will look at their staff, will look at it, and needs to make their own decisions, no matter what. That is, I feel like that's a given. Could we, at the next meeting, assuming we've got interviews under our belt, have a better feel for the ED field of candidates, revisit this to see maybe we have that unicorn that is going to be able to grab a compliance person. They have a best friend, colleague, look, pie in the sky. Or maybe at that time, we say, we absolutely need to fill this. It is getting crazy. I know July, I believe, was kind of a slow month for audits, if I remember correctly, and I think Karen was trying to do as many as she could before she left. Or we say, sorry, everyone, for so many changes, because I want to think about the providers as well. We threw all new compliance requirements at them this year. It's been a lot of change. Sorry, funding this cycle is going to look very, very different because we ended up in it where we are, that nobody could have really predicted this. So to summarize, I would like to revisit. I am leaning a little bit more towards we should fill it, but I also don't want to put the wrong person in there who maybe doesn't work well with the ED. I don't want to feel like we're taking power away from the ED, and I do feel like why not use the opportunity since it's here to take that broader look at things, and I appreciate, Pete, you coming in and reminding us of that. So those are my thoughts.
Linda?
I agree with what you're saying, Amy, and also what you have said, Lindsay, too. And I think when we interview the candidates that are coming in for ED, we may have 2 candidates that we like and may have an opportunity to restructure how the positions are set up and how the office, how the organization runs. And so I think that waiting a little bit is probably a good idea, but I think it would be good to ask the people who are carrying on, who were working with Karen, how they're doing, if they're drowning, and if we can get some temporary help to help them so that we don't have this big hole for...
They're not drowning, I can tell you. I've talked to them.
Go
They're
ahead.
not drowning.
I can't hear you.
Oh, they're not drowning right now. I've talked to them. They are
Okay.
going out and carrying on and stuff.
Okay, so if they're not drowning and if they get to a place where they are drowning or they do need help or guidance on something, that we could look at that time. But I think it would be good to interview at least the executive director candidates that we have now and see if there's somebody who might be a deputy, like however we or she decide or he decides to divide those roles. We do know that just having an executive director was a lot of work and a lot of strain. So there may be a way to recraft how those people work together, and I think that that's valid, but it would be good to see who's already applied for the ED position.
Yeah, I mean, I think by the end of the month, you all will look at it, and I say there's 6 right now that have filled out the county app. That does not mean, I want to be real clear to you, that doesn't mean the 6 you're all going to like. I'm just saying 6 are qualified, they filled out the application by the county. Carolyn?
Sorry, I just wanted to circle back around. I agree. I appreciate, Lindsay, to all of your input. I agree with all your statements as far as it would be nice, it is nice to have somebody with that is more clinical for sure in one of those positions, but I think at the same time, it's one of those positions. I don't think that really both of those positions need to have that. I think Linda has a great suggestion of, look through the EDs, and if we feel that there's somebody there that could fit, then, there's a lot of times when you're interviewing and you have 2 really good candidates and you're like, I wish I could hire both of you. This may be an opportunity that we really can. So the one question, though, that I had was to kind of address what Christina was talking about, going into allocations, and maybe Bridget or Melanie, because I'm assuming you guys will be heading up the applications. And I did not, I was on I'm on compliance also. And I don't know that I use those numbers a little bit, but I use the application numbers I felt like were more telling. So do you, when you look at and review the applications going into the funding cycle, do you use the application more, or do you use the compliance and audit numbers more? Or is it kind of both? Both. So do you feel like, if we just keep going and do what we can do, that we're going to be really missing a huge component of it? I just felt like I'd kind of go back to the application too, but.
We're still getting all the outcome reports, and Vicky's putting them together. So, that information is going to be there.
Okay.
the biggest thing will be like more clinical licensing type questions about programs that Karen used to be able to answer that, we don't have the expertise for, but, we can earmark our concerns and see what we can find out from people, but I don't know. It's hard to judge when we haven't seen any applications yet and we don't know what people are asking for.
I'm just thinking historically. I guess, I would bring up questions, and I know when I would bring up questions, it's like, I'll go back to the provider and ask them. And, kind of to Pete's point, as long as somebody knows who the right people are to go to are, I don't feel like that person needs to know everything. As long as you know who to go to, that's the important part. So kind of combining all of these, I'm still on the let's take a pause and see the ED and see where we go with that and kind of the qualifications. And as Pete said too, sometimes you'll get somebody who has an expertise in one area, so then they know that that's their strength, and the people that are under them need to have a different strength. So I still am for, leaving this for an ED and seeing after we fill that position.
I think once you guys look at the applications like I have, and I've gone through every single one of them, it does, to me, there looks like, yeah, you could do this one for an ED and you could do this one as a deputy. There is some clear-cut things going on once you look at those applications. That's all I'm saying. Because you do have clinical people, you have non-clinical, you have the whole thing.
I have one question, Connie, maybe for Pete.
Sure. I'm trying to find you here. Okay.
So, just in a timeliness, right? So if the board decides, okay, yeah, we want to move forward with replacing the job as is with the current job description.
For the compliance officer.
For the compliance officer, yeah. I always think about the timeliness of decisions and how long you leave an application open for. If we put a job out there and we are wanting to gather candidates just to see what kind of candidates come of interest, but decide later not to move forward with it or to postpone, is that an option, or does it need to, through county HR, be like, yes, we're posting it and we're going to fill it by X date? Or can we say we're posting it and we're waiting for the perfect candidate?
Or change the thing to a deputy director. I'm just saying.
Yeah.
If you're not sure what you're going to do, I wouldn't recommend posting. Like if you, well, we're going to call this, but we might call this, but there's no legal obligation to, once you post an ad, you have to hire somebody within X period of time. Not at all. And sometimes there's a clear date when it says applications must be received by, July 21st. I often see in your more executive positions, say applications will be collected until we have enough candidates, and just trying to accelerate the process, right? If they're interested people then realize that they've got to respond pretty fast. But like I said, I do get a little uncomfortable with just throwing out a net to see what you get, and then we'll decide if we really want to fish. And that's maybe a bad analogy, but but it's not. There's no legal concern with that.
Yeah, I asked the question mostly because if we, let's say, have a round of executive director interviews or candidates that we're not thrilled about, I believe this board is going to wait for the right candidate. And if that occurs, I think I'll make an assumption that we all might then go, let's move forward with, replacing the compliance officer position. In the meantime, then the clock ticks again and again and longer. So, for me, the option to not make it a deputy director, but just, here's the job description, replace the position, who are the candidates, it's open for 60 days, gives us the option then to call those candidates and interview if the board decides to do that. But if we wait a month, we wait another month, and then we got to decide to post the thing and then give it 2 more months, we're, stacking up here. So I appreciate the answer to that, because I think there could be, a turnaround time issue is, I guess, what I'm alluding to, that I want to avoid if the board decides to keep the compliance officer role as is.
I also get a reason to kind of know what you're doing before you go public with a job ad is you are marketing yourself too, right? You're competing for talent, and talented people who might be your next director are going to wonder, hey, I saw this ad was up and now they pulled it back down. They renamed it. They were going to wait until the director was hired. Now they're not. And those kinds of things can be recognized by candidates in a competitive marketplace. And I don't know how big a pool of candidates you guys are going to be competing for, but those are things that sometimes you can see and put up red flags.
Just so the board knows, and you guys can correct me if I'm wrong, but when Karen left and went to the Community Foundation, we had a heck of a time filling that position. We didn't have anybody that wanted compliance. And then Karen came back and said, it wasn't a good fit, I want back my job. Am I correct? There were no applications for compliance. It was a tough job. I'm just throwing that out there so you know that. Any other discussions with Pete before I let him go and we move on? Okay, well, thank you for coming in.
I appreciate the opportunity to throw in my 2 cents, and and moreover, I just appreciate all your service, because I know whatever disagreements are, it's all coming from the right place, so thank you.
Thank you for coming. Okay. Moving right along, since I put on my glasses, we have the nomination of officers. So I need to have a nomination from the floor and a second and discussion. John? Can you make a nomination? The people that are running can't make their own nomination. You can? Yeah. Okay.
Well, I'm just looking for, I'm sorry.
Page 21.
And I would like to make a motion to nominate the, do you want me to just do all of the officers right now, or? As President, Connie Machini. As Vice President, Ray Lapinas. As Treasurer, Lindsay Kreisman. As Assistant Treasurer, Carolyn Schofield. And as Secretary, Amy Rath.
Do we have a second? Okay. Then we need to vote, unless there's discussion. If anybody wants to jump in, feel free to jump in, put your name in.
I have no discussion.
Okay. Well, then let's vote on it. Okay, it's passed. We got Ray and I and Amy and Lindsay and Carolyn.
Congratulations, all of you.
I don't know about that.
It was a hard campaign.
Yeah. Moving then along, the adjustments made to FY25 budget. Lindsay, are you going to do that, or Mel? Mel?
I make the motion, and we can discuss if you want.
Okay.
I'll make a motion to amend the FY25 budget as adjustments presented in this decision memo, and direct the fiscal operations manager to update the FY25 budget entry in the D365 system accordingly, as seen on page 22. Second.
Carolyn seconds it. Any discussion? If not, we need to take a vote. It passed. The next thing is available funding and funding priorities. Lindsay, do you want to?
Sure. You can turn me on.
Oh, I'm sorry. I did. Next. There.
I think I alluded to this in the report for finance, that there was a discussion about whether or not we wanted to focus on fee-for-service funding, capital request funding. There was also further discussion about mid-year allocations and if there were any particular needs assessed in the community that we felt were kind of stronger than something else. And the discussion really lended itself to funding programs that were already showing that they were going to run out of their fee-for-service dollars, utilizing our numbers, meaning the projections that Melanie makes based on their utilization history and any additional information that they provide, that would be the number that we would utilize as far as a recommendation for what we would do. Additionally, there was some discussion, and I want to follow up, before the sales tax, occurred, there was a lot of conversation about using mid-year funding and fund balance dollars to support capital request projects, and that was something that shifted a little bit when we ended up receiving less money than anticipated. At least that was the conversation, that happened at Finance. There was also some healthy discussion about continuing to use that philosophy of funds that may not have been utilized year over year to still support capital. And anybody's welcome to, jump in, but ultimately, I think what we decided is that every year is unique, depending on the need, the applicants, the programs. We had discussions around capital projects and how each capital project is also unique. There are ones that need our funding as a gap because, they have so much funding and they need to get there. There are ones that are needing all of the funding. There are funding requests for capital that are hundreds of thousands of dollars and some that are, $10,000. So that was the discussion that was had, but ultimately making sure that we continue to fund the regular services that would otherwise experience a gap seemed to be priority. And as such, I don't know if you want me to get into mid-year funding requests now, but as such, we, the spreadsheet, staff had come together for Finance, presenting us a couple of different options, but we landed on the one where we use the projections of utilization. So if, Melanie said, hey, I think they could use up to $100,000 more based on their actual utilization history, we would then say that that was sort of an eligible amount of money to consider, but depending on how much actual money we have to give in a mid-year, we would then reduce that by a percentage equally amongst the applicants. So, for example, if we were to look at the projected utilization requests for the programs that staff recommended funding, because they did not recommend funding all programs, that the dollar amount would have come out to $659,761 at the bottom of that column. But we only have $472,532. So the recommendation was to figure out a percentage comparison and then apply that to their request amounts. So in this case, I think after some updates that occurred after Finance, the percentage came out to 71.6% of what we projected they would utilize. So as an example, if you look at the very top one for AID, we project 55,000, 71.6% of that is 39,380, and that keeps us within our budget. I want to be very clear that we can always dip into fund balance. The conversation was not to do that, given the fact that we need our fund balance over the next about 5 years in order to make sure we maintain funding. So any additional dollars that we want to grant above that total 472,532 would have to come out of fund balance, or possibly any future administrative savings that could occur for the remainder of this fiscal year. But at this time, these are the dollars that we guarantee we know that we have, and so that is what we presented. Melanie, anything I missed? Awesome. Any questions?
Okay. Need a oh, I'm sorry. Carolyn?
John, did you have a question?
I do not have.
Oh, okay, you're on.
I am sorry.
That's okay. So thanks. I appreciate all of this work and the updates. I was curious though, and I didn't catch this before, and I guess that's why there was that lesser column. Do you know why, and kind of more for a foresight into going into allocations, like why some of these, the original amount requested, have there been changes in some of them that the need was much greater than even that original amount requested?
Yeah, in some cases.
So, and then that will be, we'll, just looking ahead, carry that over into the next, I guess, can we like flag stuff like that going into the next allocation cycle, if that's the case, so we can kind of weigh it better? Okay, thanks. And I appreciate, I wanted to point out too, the ones that, I think it's always really hard to tell from my standpoint where if there's other funding sources. And what I don't want to happen is us always be at the top of the list because we're easy, because we're here, people show up and, we can, we see them. So I also don't want to always be there. So I appreciate that you're looking at the other funding sources as well. So we're just not always the easy one to get money from, and that those that actually need it are the ones that get it. So thank you.
Yeah, I think this is a very fair way. Amy, go ahead.
Mine's a quick comment. I just want to say thank you for going through all of this. I don't have any questions on it because it made complete sense to me, and I just appreciate all of the work that was put in and the thought, and it's just I feel like you have made things easy for my vote, so thank you. I just wanted to voice that.
Chris?
Also wanted to say thank you. I think this is really clearly laid out, and a lot of work went into it, so I appreciate you, Lindsay, and Mel, and Bridget, everybody who played a role. And mine is not so much a question as comment, or maybe more than one comment. And it doesn't necessarily pertain to how we handle tonight. It's more an idea about how do we handle things moving forward. And that has to do with the idea that the way this is set up, there's an incentive for programs to spend quickly and run out, because now they're going to have, reached their projected utilization or exceeded their projected utilization, and they're going to need more money. And I want to try to create a system where, to the best extent possible, programs are able to project what it is that they're going to need, that they ask for that, and then they expend it judiciously to allow it to last the period of time that they have, and that we use this mid-year funding allocation process to try to solve new problems, like there's more need than there used to be. Things are more expensive than they used to be. Something happened that created a difference from our original projections, and now we need to address that. So, I think the idea of tracking rate of utilization is important, but I think that should not be our potentially only or perhaps even most primary metric for determining how to handle this mid-year allocation process. So when we think about, sequential years, how do we create for ourselves a decision rule? I think we do track that, but I also don't want to be like, okay, when we adopted my son, he would clean his plate quickly because he thought that was the only way he could get more food. I don't want to set that up. Carolyn, I do think it's important to track other funding sources, but for many of our funded agencies, we are a very small part of what they're getting, and we are not easy. The amount of the auditing process, the tracking of the outcomes, and providing those data. It's a fairly significant undertaking, and so is whether or not they're getting money from elsewhere relevant? Yeah, if they have enough, but everybody's getting money from elsewhere. We are almost never the only funding source. So, so is that the primary decision driver? Maybe not.
Right.
Can I make a comment?
I'm sorry.
I'm on. Don't
Okay.
don't turn me off. I want to highlight that, last year, people did come in and ask for the funds that they needed, right? And they said, this is what I think I can do, or, hey, I think we can grow this program, right? We can do more hours, more clients, more, services. And we oftentimes were not able to fund people at 100% of what they were capable of doing, right? And so, I think that's the other thing that I want to keep on the top of everybody's minds is that as we went through allocations last year, I can't tell you how many times we said, well, it's less, but hopefully they'll come back at the mid-year if they need it. Well, they needed it, and, even based on our projected utilization, we didn't have enough, right? Which is, unfortunate. So I do think that there's a connection between remembering, last year's amount, which is, the columns where it says original amount awarded versus original amount requested, I think is something to also look at because in some of these cases, they're just hoping to maintain what they did last year, and we may not be able to do that, but we'll do the best that we can. So I really do, Melanie, Bridget, all the team, thank you so much for, putting this together. And year over year, I think we, might be able to decide what columns we care about and what columns we don't care about, or add in things that people find of value. And once again, every single year is different. As an example, this year we, we only get applications for who puts in applications too. So, it's also one of those things where I think we need to educate, and I know they were talked about with this at Network Council, but it's important for them to hear for us what we're prioritizing as well, which, at least for me, I'll speak for me, I've always said I want to maintain the fantastic programs that are out there. I don't want to see a reduction in services year over year, if possible. That's always how I'm going to vote. So, thanks.
Okay. So we need a motion to approve this? Mid-year.
Make a motion to approve the FY25 mid-year funding request as presented.
Okay, second? It's Amy, second. Okay, we need to vote. Okay, it passed. Then, I don't believe you talked about the child, you did talk about the child advocacy and how finance did not agree to fund that, but we do need to take a vote on that. Am I correct, Bridget?
Unless you don't get a motion. And
Okay.
if you don't get if it doesn't get a motion or second.
Okay. Not fun. No. We don't have to vote on it. Okay. Because they made a recommendation not to fund it, okay? So, member comment. We're into that. Carolyn, you wanted to do, Linda first of all, sorry. Linda.
I understood what we did, and I understood, but it seemed when I was reading the decision memo that it said something different under the recommendation and motion.
Under which one?
Under the page, gosh, I don't have a number here. I think it's page 26. And thank you. And it says, under recommendation and motion, it says that we are directing that we are going to support them, and unless I'm misreading that.
Is that what it says? I don't have it.
Melanie has signed it.
Oh, Melanie, I'm sorry. Go ahead.
So when we write these decision memos, we are writing them on what it would need you guys to approve to take action on the request. So that's not really the recommendation that the staff made. It's not necessarily the direction you guys want to take, but that's the action that would need to be taken to comply with that request or to meet that request.
Okay, thank you.
So we don't do anything, we're okay.
And then the other comment that I had is, have they gotten intact as far as in contact with the grant writer?
No.
We've had a discussion with the grant writer, and they're looking into it.
Okay.
But I don't think they haven't contacted our grant writer, right?
No, they have not contacted it, but they're looking into grants.
But we're offering that to them. Okay.
Thanks. And yeah, I appreciate the comments. And I just want to say, too, that if we don't take action on it, it just doesn't go anywhere. So I didn't want to deny that personally either. So, but I just wanted to, for full transparency, put it out there. I went to Warp Core this past week, and I don't think Rob is here today, but it was a great visit. I just wanted everyone to know I visited. It is worth a visit, a very not boring visit, as you can imagine. So it was fun to see everything in their new, they have a new embroidery machine there. That was pretty cool to see. So I appreciate that. And then I had a question. I know it's member comments, so maybe we could do, but I just read an article about more opioid funding, a settlement. Is there going to be a new settlement coming down?
I'm not sure how it'll be divided.
I hope so, because it was a pretty good one.
It was a good one.
Yeah, so I hope we see some of that. So if anyone finds out, I would appreciate it, but I will keep an eye out for that as well. So thanks.
Other member comments? Anybody? Did you want to say something about Network Council? No?
Oh, geez, yeah, sorry, that was my other thing. Sorry.
Thank you.
Sorry, I did have that one on my first sheet of lists to do. I attended Network Council yesterday. And I have to say, and I won't go through all the things because I think we get notes and stuff on it, but I want to say the one thing that I do really appreciate and I think is well received there is Melanie and Bridget. They've done a great job of trying to focus and streamline that group. I mean, that's a great group that knows how to network. They know how to find each other. So they are going to be reducing the number of meetings that Network Council itself has, keeping the other meetings of intake coordinators, and there was one other meeting that they have, and kind of changing it up a bit, I think, to more meet the needs. So it's not like, oh, it's another meeting we have to go to, that it's actually going to be a productive one, and hopefully they'll start giving some ideas for presentations. Then that will be more valuable, I think, for everybody, including our staff who has to take the time to prepare and attend as well. So I just think that's a great change. Thank you guys for implementing that. I think it's going to be good for everyone involved.
Okay. Any, under member comment, I just want the board to know, I don't know if I told you last time, but we as a board gave Karen a plant for her new office and a gift card, and it was signed by all of you, by the board. So I just want you to know that was done before Karen left. Anyone else have any member? Oh,
I wanted to say it at a board meeting. I know I've had a chance to talk with a handful of you, and one of the things that happened when you voted us all into positions, I had requested for the assistant treasurer position specifically for Carolyn because my family is going to be relocating this end of summer into fall, and so I will not be completing my full 4-year term with the Mental Health Board. It looks like December 1st will be kind of my end date. So as part of that, I had asked and requested to have an assistant treasurer because there's a lot going on right now. And I wanted to be able to bring in a number crunching friend into the conversations. So just a heads up, if I haven't told you, now you know. So, yeah.
okay, anything else? If not, I need a motion to go into executive session.
I'll make a motion to go into executive session for personal matter at 7 in a review of executive session meetings pursuant to 5 ILCS
Se-
20-2 C121 approval of closed session.
Second?
I'll second.
Okay. All those in favor? Aye. Okay. Roll call.
Chris Brune? Yes. Adam Carson? Linda Hoke? Here. Lindsay Keisman? Here. Ray Lapinus? Amy Rath? Yes. John Reinert? Yes. Carolyn Schofield? Yes. Connie Machini?
Yes. First, you have the minutes of our executive. Oh, sorry. Okay, you have the minutes in front of you. I said a while.
From standing is okay, but it's like going from, like sitting to standing is not.
So can I have a motion to go into regular session?
Make a motion to return to regular session.
Second? Roll call.
Chris Broom?
Here.
Adam Carson? Linda Hope? Here. Lindsay Kreisman?
Here.
Ray Lapinus? Amy Rick? Here. John Reiner? Here. Carolyn Schofield? Here. Connie Machini?
Here. Okay, a motion to approve executive session minutes I need.
I'll make a motion to approve the executive session minutes as presented on November 26, 2024, February 25th, 2025, March 25th, 2025, April 15th, 2025, April 22nd, 2025, and April 7th, 2025.
Second?
Second.
Okay. Discussion, yeah, do you want discussion?
I was not here for the November, I could still approve or vote yes.
Yeah.
I just wanted a full
Okay.
disclosure.
Discussion, anybody else want discussion on the executive session? Then we need roll call to approve them. Oh, sorry. Chris, help me out. It's approved. Okay. Now I need a motion to adjourn. Second? Okay, you guys. We're done.
All in favor?
Aye.